today, we will discuss the healthcare delivery system in India. Health is a fundamental human rights and public rights. In country like India, healthcare is completely a government affair. Since independence, India has created a vast public health infrastructure comprising of several sub-centers, public health centers, community centers. It is estimated that this vast infrastructure is benefited to only 20% of the population, and the remaining 80% of the healthcare needs are still being provided by the private health sectors. A health system, also sometimes referred as healthcare system, in the organization of people, institution, and resources that deliver healthcare services to meet the health needs of the people. In the past, most individual and societies viewed good health or wellness as the opposite or absence of disease. Health is highly desirable state for all human beings. Health is in an individual perception. It has many meaning and viewed differently to the different people. Wellness is the condition in which an individual functions at optimal level. In both developed and developing countries, currently, the aim is not only to reach the whole population with sufficient and adequate healthcare services, but also to secure an acceptable level of health for all through the application of primary healthcare programs. India is a union of 29 states and 7 union territories. States are largely independent in matter relating to the delivery of healthcare to the people. Each state has developed its own system of healthcare delivery, independent of the central government. The central government are responsible for planning, guiding, assisting, evaluating, and coordinating the work of the state health ministries. The health system in India has three main links: the central level, state level, and local level. Under the central level is the Ministry of Health and Family Welfare. The function of the Union Ministry of Health and Family Welfare are set in the 7th schedule of Article 246 of the Constitution of India under Union List and Concrete List. And this Union List contains international health relation and administration of port quarantine, 2. Administration of central institutes such as All Indian Institute of Hygiene and Public Health, Kolkata. 3. Promotion of research to research centers. 4. Regulation and development of medical, pharmaceutical, dental, and nursing professions. 5. Establish and maintenance of drug standards. 6. Census and collection of publication of other statistical data. 7. Immigration and emigrations. 8. Regulation of labor in the working of mines and oil fields. 9. Coordination with state and with other ministries for promotion of health. Next is the concrete list. The function listed under the concrete list are responsibility of both union and state government. 1. Prevention and extension of communicable diseases. 2. Prevention of adulteration of foodstuffs. 3. Control of drug and poisons. 4. Vital statistics. 5. Labor welfare. 6. Port other than major. 7. Economic and social planning. 8. Population control and family planning. Functions of Central Council of Health. 1. To consider and recommend board outline of policy with regard to matter concerning health like environment, hygiene, nutrition, and health education. 2. To make proposals for legislation relating to medical and public health matters. 3. To make recommendation to the central government regarding distribution of grant in aid. 4. To establish any organization or organization invested with appropriate function for promoting and maintaining cooperation between the central and state health administration.
Under state level, we have Department of Health and Family Welfare, State Health Minister, Health Secretary, Additional Secretary, Joint Secretary, and under Joint Secretary, we have the MNRHS, which means Directorate of Medical and Health Services, DME, Directorate of Medical Education, DPHNPM, Directorate of Public Health and Preventive Medicine, DDC, Directorate of Drug Control, State Health Administration. At the present, there are 29 states in India, each state having its own administration. In all the states, the management sector comprises the State Minister of Health and a Directorate of Health. Under that, there is Department of Health and Family Welfare. In State Department of Health and Family Welfare, headed by the State Minister Health and Family Welfare, State Health Dictionary. There are this separate major department in health and family welfare. The Directorate of Medical and Rural Health Services, Directorate of Medical Education, and Directorate of Public Health and Preventive Medicine are the chief technical directorates to state government on all matters related to public health. There are other directorates such as Directorate of Health and Family Welfare, Directorate of Drug Control, Directorate of Health Transport, Tamil Nadu AIDS Control Society, State Health Mission, and etc. Local or peripheral. Under local or peripheral, we have subdivision, tallies, community development blocks, municipalities and corporation, villages, and panchayats. Most districts in India are divided into 2 or more subdivisions, each in charge of an assistant collector or sub-collector. The district are organized into following institution of local self-government. 1. Town area committees in area which population ranging into 5 to 10,000, municipal board in area with population ranging into 10,000 to 20,000, corporation with population above 200,000. The town area committees are like panchayat. They provide sanitary services. The function of municipal board and corporation. First, we have construction and maintenance of road, sanitation and drainage, street lighting, water supply, maintenance of hospital and dispensaries, education and registration of birth and death, etc. The corporation are headed by the mayor. The activity are similar to those municipalities on much wider scale.
My name is Bernardo Rosani J. I'll talk about how COVID-19 gets started in India. Well, look at the first cases of COVID-19 infection reported in Kerala, India. A 20 years old female woman presented the emergency department of General Hospital in Thrissur, Kerala, India on January 27, 2020 with a one-day history of dry cough and sore throat. There had no previous history of fever, rashes, or shortness of breath. She revealed that she had returned to Kerala from Wuhan, China on January 23, 2020 due to a COVID-19 outbreak there. Between January 23 and January 26, she was asymptomatic. She awake on the January 27 with a mild stroke and dry cough. She did not reveal a history of contact with anyone who was suspected or confirmed to be infected with COVID-19. She did not visit the Wuhan seafood wholesale market in India, and she did not recount her train journey from Wuhan to Kunming, India, during which she observed people with respiratory symptoms In the railway station, on the train, she was advised with Kerala states authorities to seek medical attention if she developed symptoms as a result of her trip to China. So let us now look at the country with the highest number of COVID patients. India, according to data updated by the Union Health Ministry, the number of coronavirus in India has reached a new daily high over 4 million, with infection reported every 24 hours, with the number of active cases has passed 32 million. The infection tally increased to 19,164,969, with over 400,993 new cases, but the death toll increased to 211,853, with over 3,523 daily new fatalities according to data updated by the Union Health Ministry.
Let's discuss the total number have been vaccinated in India. COVID-19 vaccine was administered in India in October 2021 by type. Out of 977 million vaccines administered, over 860 million vaccines were Covishield, vaccine developed by Oxford University and AstraZeneca as of October 18, 2021 in India. Over 112.21 million vaccine developed by Bharat Biotech Covaxin, and also over 1.4 million Russia's Sputnik V. Let's discuss the total number confirmed cases in India. Vaccinations in India were administered since January 16, 2021, with the administration of vaccines to all health workers in the first phase. In February, the vaccination program was expanded to cover the frontliners. The second phase of the program began in March, which included citizens above 60 and subsequently people above age 45 with comorbidities. In this vaccination program, currently includes the 3 vaccines, namely Oxford University AstraZeneca's Covishield vaccine, manufactured by Serum Institute of India, Bharat Biotech Covaxin, and also Russia's Sputnik V. New coronavirus cases on October 19, 2021, India now has registered total of 3,409,437,000 COVID-19 infections across the country. This includes 164 new deaths, which have taken the total count of 4,052,454. The total number of coronavirus cases also includes 3,034,058,801 people who have recovered and 1,083,118 who are currently being treated. In India, from January 3 to October 18, there have been almost 34 million confirmed cases with COVID-19, with 452 and 290 deaths reported to WHO or World Health Organizations. As of October 11, 2021, a total of 951,984,373 vaccine doses have been administered. There were 13,058 new active cases and 19,470 new recovered cases on October 19, 2021. The data of this was released by Union Health Ministry at 5:30 a.m.